What's better for recovery, heat or ice? My name is Faris Solomon. I got my degree in pre-physical therapy, plus I've been playing sports since I was 3. And here's what I learned about the topic. So how do they work? Well, they direct the transfer of heat to and from the targeted tissue. The greater the difference between the ice pack or the heat pack and the skin, the greater the results will be and the effects will last longer. Now, the energy always goes from high concentration to low concentration, which means it always goes from hot to cold. And the average skin temperature is around 91 degrees Fahrenheit. Now here's the fun part. Each 1.8 degrees worth of change would result either in a 13% increase if using heat, or a 13% decrease if using cold to the tissue's metabolic rate. And what that is basically the speed of energy regeneration within the targeted area. Ice, aka cryotherapy. So what does it do? It constricts the blood vessels within the targeted area, which decreases inflammation, lowers the chances of a secondary injury, and lowers the rate of damaging cellular reactions within the cell. So that's best used when it's dealing with an acute injury or inflammation, which basically means an injury that occurred suddenly. And that's because it reduces the swelling and the muscle spasms, which overall lowers pain. And the maximum effects usually are reached when the temperature of the skin is lowered to 57 degrees Fahrenheit, and then the effects would usually last anywhere between 20 and 60 minutes. Examples of cryotherapy include ice sprays, ice packs, cold whirlpools, contrast baths, ice plunges, and so on. And the temperature range usually goes from 32 to 65 degrees Fahrenheit. Now, there is a usual routine of sensations you would experience using cryotherapy. Usually start with obviously feeling cold, slightly uncomfortable, followed by a burning sensation, aching, and then absence of pain. By the way, don't confuse this last step with being invincible. Of course, there are situations out there where you shouldn't use cryotherapy. These include if the skin appears whitish or bluish, if you have an open wound, or if there is any other medical condition that would actively get worse if you use cryotherapy. Heat, aka thermotherapy. Well, what does this one do? It dilates the blood vessels within the targeted area, which actually increases swelling. But since the blood flow is higher, the rate of removal of cellular debris also is higher, and it helps increase the rate of delivery of oxygen and nutrients to the area, which decreases muscle spasms. Now, the maximum therapeutic effects for thermotherapy can be reached when the skin temperature ranges between 104 and 113 degrees Fahrenheit. And usually the effects would last up to 30 minutes. Now, examples of using the modality can be heat pads, sauna, and therapeutic ultrasound. Thermotherapy is usually used to treat chronic pain, lower ranges of motion, and muscle spasms. Now, something to keep in mind is that heat-related injuries occur more often than cold-related ones. So a good idea would be to check skin integrity every 5 to 7 minutes. Overall though, thermotherapy should not be used if there is a recent injury, or if the skin has a lower sensation, or if there is any other medical condition that would actively get worse by the use of thermotherapy. Now that we have covered both methods, it's important to highlight that healing rate is individual, and knowing which phase of recovery you're in is incredibly useful in order to understand which method would serve you best. Because the active process of inflammation due to an injury must be reduced first and foremost before considering the use of heat. Few questions to ask in order to gauge the progress of inflammation would be: does the swelling continue to increase? Does it get worse during the activity? And is the pain limiting my range of motion? Now, if the answer is yes to any or all of them, then you can ice. If the answer is no, then it's probably safe to use heat. Under normal circumstances though, when not having to deal with an injury, I use ice to recover from a max-out workout session, just to reduce any increased swelling or bruising. But if it's any other normal session, then I would use heat, just because it decreases muscle spasms and also relaxes the body.